There are effective treatments for certain forms of hair loss. You might be able to stop or at least reduce hair loss. In other cases, such as alopecia areata, where there is patchy hair loss, your hair may recover on its own after a year or so. There are both medical and surgical options for treating hair loss. It actually depends on the phase of the hair loss you're currently in to determine the treatment you should be essentially looking at. Your doctor could suggest stopping taking a certain medication for a few months if that's the reason you're losing hair. Other treatment options for pattern or hereditary baldness may also be taken. The most typical choices are Minoxidil. Minoxidil is available over the counter or non-prescription in liquid, foam and shampoo forms. To stop additional hair loss and to begin hair regeneration, therapy must last at least for 6 months. To maintain the benefits of the medication, you must continuously use it even if you've already received the results. However, there might be possible side effects that include scalp irritation and unwanted hair growth on the adjacent skin of the face and hands. Some of the users have also faced impotence. Finasteride. Generally, men are prescribed this medication, but women can also take this, as studies have reported thicker hair in women who consume this medication. This is a daily medication that you will have to take. The hair loss of men using finasteride slows down. Before you can determine if it's working for you, it can take a few months. To preserve any benefits, you must continue taking it. For males over 60, finasteride might not really operate as effectively. Reduced libido, sexual dysfunction, as well as an increased risk of prostate cancer are rare adverse effects of finasteride. Women who are or might be pregnant should refrain from handling broken or crushed medications. A low-level laser device has received approval from the Food and Drug Administration to treat male and female hereditary hair loss. It increases hair density as demonstrated by a few short trials. However, further research is required to demonstrate long-term effects. Low-level laser therapy, also referred to as red light therapy and cold laser therapy, irradiates photons into scalp tissues. These photons are absorbed by weak cells to encourage hair growth. It's widely accepted that the procedure is safe, tolerable, and less invasive than the hair transplant surgery. Because the results of laser therapy are inconsistent, the conclusion of the medical community seems to be that it appears to work for some people but not for others. More research is needed, but some of the studies have yielded encouraging results. According to a 2014 study, low-level laser therapy appeared to be safe and effective for hair growth in both women and men. A 2013 study of 41 males aged 18 to 48 found that laser hair treatment provided a 39% increase in hair growth over a period of 16 weeks only. Just the top of the head is impacted by the most prevalent kind of permanent hair loss. Making the most of your remaining hair is possible with a hair transplant or a restoration procedure. A dermatologist or cosmetic surgeon performs a hair transplant operation by removing hair from a hair-bearing area of the head and transplanting it to a bald place. 1 to many hairs can be found in each hair patch. Occasionally, a wider section of skin is removed, including many hair clusters. While you won't need to stay in the hospital for this surgery, it is uncomfortable, so you'll be given sedatives to help with the pain. Bleeding, bruising, edema, and infection are all potential dangers. For the desired result, you could require more than one procedure. However, hereditary hair loss will eventually progress despite the surgery. So you need to preserve your hair after you get hair transplant surgery as well. Well, these methods are harmful, comes in a lot of pain, and has a lot of side effects as well. we would recommend these procedures only to the people who are in stages 4 and above of the hair loss. One of the lifesaver is derma rolling. So does it really work? To get to know more about this tool right here, subscribe to the Hair.Dudes channel and stay tuned for the video on derma rolling. For the rest of the viewers, don't you worry, we've got your back. Watch our video 8 habits to regrow your hair to help you regrow your back, your lost hair, and get your hair back without any side effects. Although this method would be slow and less immediate as the other artificial procedures, it is all natural. For all of the people who are in the early stages of hair loss, do follow a weekly hair care timetable. To get to know more about how to take care of your own hair throughout your week, watch our video, The Weekly Hair Care Timetable, by clicking the link above. Thank you for watching this video, guys. If you liked the video, please hit that like button and subscribe to the Hair.Dudes channel for more hair related content. And let your friends say, "You've got amazing hair, dude."
Subscribe.